Dr. Burgess, one last question. I'll make one point and then one last question. This is a one-page bill. It's easy to read, it's easy to understand. Dr. Cassidy, I think, got it really right. If you like your health care, you can keep it. In a time of uncertainty, what a clear message that Dr. Bill Cassidy from Louisiana has. If you like your health care, you can keep it. We do things all the time where we say, well, this thing was out there, but now maybe we ought to rethink it. I think this is definitely a think three times, saw once issue. Dr. Burgess, there are families not unlike mine that have disabled children and wives attached to these insurance policies. Back home in Dallas, Texas, it is my understanding that specialty hospitals probably or may not be included, and I know of several, I don't want to point their names up, but are not accepting ObamaCare. When my 11-month-old child was sick, I rushed him, Alex, a Down syndrome young man, immediately to the hospital, an expected Children's Hospital of Dallas to do the surgery. They did it all. Today, the way I understand it is he'd have to go to another hospital, one that was not set aside exactly for babies with the right doctor, the right tools, the right things. Likewise true of specialty hospitals for breast cancer and lots of women's medical issues. What is being done by the administration to fix this?
I do not know the answer to that question, what is being done by the administration. But what you are pointing out, there's actually two problems here. One is the construction of narrow networks. The insurance companies say we can hold our costs down by restricting the number of providers, both hospitals and physicians, and other ancillary practices that a patient can access. That's one of the only ways they have of holding their costs down, and so they feel justified in doing that. The other part of the dilemma that you're drawing attention to is you have some significantly large hospitals that are pretty specialized, cancer treatment, children's, and they have not signed on to be part of the provider network because they are concerned about reimbursement rates. So you've got narrow networks on the side of insurance companies who are trying to hold down their costs, and that is one way they feel it is within their power to do. And on the other side, you have hospitals that say, I'm scared to sign up with these folks because I don't know what they're going to be paying. And as a consequence...
Or maybe they do.
Or maybe they do. But as a consequence, the patient's caught in the middle.